misleading term because a ramus contains both sensory and motor components, and a root is either sensory or motor. Roots reorganize to form the upper, middle, and lower trunks, with each trunk further dividing into anterior and posterior divisions. These divisions combine to form the lateral, posterior, and medial cords. The major terminal branches of the plexus are the axillary, musculocutaneous, radial, median, and ulnar peripheral nerves. Additionally, there are several other nerves which arise from the brachial plexus prior to the formation of its terminal nerves. These include motor branches, which innervate superficial muscles of the anterior chest and the muscles of the scapular region, and cutaneous branches which supply the skin of the arm and forearm.
In this close-up view of the axillary region of our cadaver specimen, we can see some of the components of the brachial plexus. The clavicle has been reflected so that the roots of the plexus are more visible. These roots are from the ventral rami of spinal nerves C5, C6, C7, and C8. The ventral ramus of spinal nerve T1 cannot be seen in this view. Roots of C5 and C6 combine to form the upper trunk. C7 continues as the middle trunk. Roots of C8 and T1 form the lower trunk. Each trunk separates into anterior and posterior divisions. The axillary artery is used as a reference landmark for naming the cords. The medial cord is the continuation of the anterior division of the lower trunk. The lateral cord arises from the anterior divisions of the upper and middle trunks. The posterior cord arises from the posterior divisions of all three trunks. The terminal nerves are formed from the cords. The axillary nerve and the radial nerve arise from the posterior cord. The musculocutaneous nerve is a continuation of the lateral cord. Contributions from the lateral and medial cords form the median nerve. The remainder of the medial cord is the ulnar nerve.
In this specimen, we will trace the course of the peripheral nerves through the upper limb and describe the distribution of each nerve in the region. The axillary nerve, a branch of the posterior cord, travels to the shoulder region to innervate the deltoid and teres minor muscles. It also furnishes sensory innervation to the skin and the joint capsule of the shoulder. The radial nerve, the continuation of the posterior cord, courses to the posterior humerus and descends through the arm and forearm to furnish motor fibers to all the extensors of the forearm, wrist, and fingers. It supplies sensory fibers to the skin of the posterior arm, to the skin of the middle of the posterior forearm, and to the skin of the lateral part of the dorsum of the hand, with the exception of the tips of the thumb, second, third, and part of the fourth fingers. The continuation of the lateral cord, the musculocutaneous nerve, pierces the coracobrachialis muscle as it travels toward the anterior arm. It gives off motor branches to the muscle as it travels through it. When the biceps brachii muscle is reflected, we can follow the course of the nerve through the arm as it overlies the brachialis muscle. The musculocutaneous nerve provides motor innervation to the muscles which flex the forearm at the elbow. It terminates as a cutaneous nerve which supplies the lateral forearm. The median nerve, formed from contributions of the lateral and medial cords, descends through the arm without giving off any branches to the region. After the median nerve crosses the elbow anteriorly, it courses deep in the forearm and furnishes muscular branches to most of the muscles in the flexor compartment which flex the wrist and fingers. After it crosses the wrist and enters the hand, the median nerve supplies the thenar mass of muscles which includes an abductor, flexor, and opposer of the thumb. It also supplies the lateral two lumbrical muscles. The cutaneous distribution of the median nerve is to the skin of the lateral two-thirds of the palm, including half of the ring finger and the dorsal tips of the thumb, second, third, and part of the fourth fingers. The ulnar nerve, the continuation of the medial cord, also travels through the arm without giving off any branches. It courses posteriorly at the medial epicondyle of the humerus near the elbow. The ulnar nerve descends through the forearm between the flexor carpi ulnaris and the flexor digitorum profundus muscles. It gives off motor fibers to these two muscles as it travels between them. In the hand, the ulnar nerve supplies most of the intrinsic muscles, which includes the hypothenar mass, the medial two lumbricals, the interossei, and the adductor of the thumb. Its cutaneous distribution is to the medial third of the anterior and posterior hand. The formation of the lumbar plexus can be reviewed using this illustration. Ventral rami of L1 through L4 spinal nerves rearrange and combine to give rise to 6 major nerves. The ventral ramus of L4 joins with L5 ventral ramus to form the lumbosacral trunk. This large nerve trunk contributes to the formation of the sacral plexus and is not part of the lumbar plexus. 2 nerves, the iliohypogastric and ilioinguinal nerves, arise from a common trunk of L1. The iliohypogastric nerve is sensory to the skin of the lower abdomen and gluteal regions. The skin of the groin region and external genitalia are supplied by the ilioinguinal nerve. Both nerves innervate abdominal wall musculature. Another nerve, the genitofemoral, arises from the ventral rami of L1 and L2. The cutaneous distribution of this nerve is to the scrotum in males and the labia majora in females. It also supplies the skin of the superior part of the anterior thigh. The cremaster muscle in males is innervated by motor fibers of the genitofemoral nerve. The nerve which furnishes sensory innervation to the lateral thigh is the lateral femoral cutaneous nerve. It arises from L2 and L3 ventral rami. It is only sensory and does not contain motor fibers. The largest nerves of the lumbar plexus arise from L2, L3, and L4. They are the femoral and obturator nerves. We will now identify these 2 nerves on our specimen and describe their distribution to structures in the anterior and medial thigh. The major nerve to the muscles and skin of the anterior thigh is the femoral nerve. This nerve exits below the inguinal ligament and gives off motor fibers to muscles in the region. Some of these muscles flex the thigh at the hip and others extend the leg at the knee. Several branches to these muscles of the anterior thigh are shown in this dissection. The longest and largest branch of the femoral nerve, the saphenous nerve, continues to descend through the thigh and leg. It is sensory to the skin of the medial knee, leg, ankle, and foot regions. Other cutaneous branches of the femoral nerve, which furnish sensory innervation to the anterior thigh, were removed during preparation of this specimen. In this specimen, the obturator nerve and several of its motor branches can be identified as they travel to innervate the adductor muscles of the thigh. These muscles are located on the medial thigh. Sensory branches of the obturator nerve provide cutaneous innervation to the skin overlying the muscles in this region. We will use this illustration to review the formation of some of the major nerves which arise from the sacral plexus. Ventral rami of spinal nerves L4 through S4, including those of the lumbosacral trunk, contribute to the plexus. As in the case of the brachial plexus, the ventral rami rearrange and combine to form anterior and posterior divisions. Many nerves, some of which are not shown in this illustration, are formed from these divisions which supply structures located in the gluteal region and the lower limb. The superior gluteal nerve from L4, L5, and S1, and the inferior gluteal nerve from L5, S1, and S2 furnish motor fibers to the gluteal muscles. A major sensory nerve, the posterior femoral cutaneous, arising from S1 through S3, distributes to the skin of the inferior gluteal region and the posterior thigh, popliteal region, and proximal leg. Ventral rami of S2 through S4 contribute to the formation of the pudendal nerve, which innervates skin and muscles of the perineum. The largest nerve and longest nerve in the body, the sciatic, arises from L4, L5, and S1 through S3. It is actually two nerves, the tibial and common peroneal, which are contained within a common connective tissue sheath. We will now identify the sciatic nerve on our specimens and follow the course of its branches through the lower limb. When the gluteus maximus muscle is reflected away from its origin on the sacrum, the large sciatic nerve can be identified. It exits the pelvic cavity and enters the gluteal region between the piriformis and superior gemellus muscles. It travels superficial to the lateral rotator muscles of the femur as it descends toward the thigh. In this specimen, we will trace the course of the sciatic nerve and its branches after it emerges below the inferior border of the gluteus maximus to enter the thigh region. The sciatic nerve descends, giving off muscular branches to the hamstring muscles, which extend the thigh at the hip and flex the leg at the knee. In the thigh region, the sciatic divides into its two components, the tibial nerve and the common peroneal nerve. The tibial nerve courses through the thigh surrounded by the hamstring muscles and continues through the popliteal fossa of the knee region. Below the knee, it furnishes motor fibers to all of the muscles of the posterior compartment of the leg as it descends. Some of the actions of these muscles in the posterior compartment include plantar flexion of the foot at the ankle and flexion of the toes. The nerve exits the compartment on the medial side of the ankle. In the foot, the tibial nerve branches into the medial and lateral plantar nerves. These nerves supply both sensory and motor innervation to the skin and muscles of the sole of the foot. As previously described, the other branch of the sciatic is the common peroneal nerve. It follows the tendon of the biceps femoris muscle laterally at the knee and encircles the head of the fibula to reach the anterolateral leg. We will follow the course of the branches of the common peroneal in this anterior view of our specimen. Below the knee, the common peroneal divides into superficial and deep branches. Proximally, the superficial peroneal nerve lies deep in the lateral compartment of muscles. The nerve supplies motor innervation to the muscles of the compartment which evert the foot at the ankle. Distally, the nerve becomes cutaneous and supplies sensory innervation to most of the dorsum of the foot. The other branch of the common peroneal nerve, the deep peroneal nerve, courses within the anterior compartment of muscles of the leg. It innervates these muscles, which dorsiflex the foot at the ankle and extend the toes. A branch of the deep peroneal nerve provides cutaneous innervation between the great and second toes. In this presentation, we reviewed the anatomy of the spinal cord and the location and formation of the plexuses of spinal nerves. Major nerves which arise from the plexuses were also identified on our specimens. The anatomy of the brain and cranial nerves are described in the videotape entitled The Human Nervous System, the Brain and Cranial Nerves. The cardiovascular system consists of the heart, a muscular pump, and the blood vessels, a closed system of tubes which transport blood throughout the body. The pathway of blood circulation from the heart through the lungs and back is the pulmonary circuit. The systemic circuit is the pathway of blood flow from the heart to the capillary beds of all parts of the body and then back to the heart. In another videotape, The Human Cardiovascular System, the Blood Vessels, we discuss the pulmonary and systemic circuits of blood circulation and identify many of the major arteries and veins which form these circuits. In this presentation on the cardiovascular system, we review the external and internal anatomy of the heart and identify its coronary and associated great vessels. The pathway that blood travels through the heart is also described. In this specimen, the chest muscles, vessels, nerves, sternum, and ribs have been removed so that we can see the contents of the thoracic cavity. The diaphragm is the large respiratory muscle which separates the thorax from the abdominal cavity. Lying on either side of the midline in the thorax are the lungs. Between the lungs is the region of the middle mediastinum, where the heart is located. About 2/3 of the heart lies to the left of the midline, with the remainder of the heart lying to the right. Surrounding the heart is a double-walled sac called the pericardium. The pericardium consists of an outer fibrous layer and an inner serous layer, which is further separated into parietal and visceral components. The fibrous pericardium is composed of tough, dense connective tissue, which helps to support and anchor the heart. This fibrous layer of connective tissue is continuous with the connective tissue around other structures in the region. Inferiorly, it fuses with the superior surface of the central tendon of the diaphragm. Superiorly, it joins with the connective tissue surrounding the superior vena cava, aorta, and pulmonary trunk. In this dissection, the pericardium is opened and reflected away from the heart. The shiny, glistening layer on the inside of the fibrous pericardium is the parietal layer of serous pericardium. The visceral layer of the serous pericardium forms the outermost layer of the heart wall and is called the epicardium. The space between the parietal and visceral layers of the serous pericardium is the pericardial cavity. It contains a small amount of serous fluid, which is produced and maintained by plasma ultrafiltration and absorption in the serous membranes. Serous fluid lubricates the membrane surrounding the heart, allowing the heart to move freely as it rhythmically contracts and relaxes. In this specimen, the pericardium is removed to show the relative positions of some of the external features and associated great vessels of the heart. The apex is pointed downward and is about 8 centimeters to the left of the midline near the 5th intercostal space. The region where the great vessels exit and enter the heart superiorly is the base. It lies at about the level of the 3rd costal cartilage. The diaphragmatic surface, named because of its close relationship to the diaphragm, is found behind the xiphisternal junction near the 6th or 7th costal cartilage. These positions are only average locations, and each specimen may differ slightly. The heart is partitioned internally by septa, or walls, into 4 chambers. The external surface of the 3 chambers, which can be identified in this view, include the right atrium, the right ventricle, and the left ventricle. The 4th chamber, the left atrium, cannot be seen with the heart in this position. The atria are receiving chambers for blood returning to the heart, and the ventricles are the actual pumping chambers of the heart. The great vessels associated with the heart are the veins which deliver blood to the atria and arteries which transport blood away from the ventricles. The large vein which conveys deoxygenated blood to the right atrium from the regions of the body above the diaphragm is the superior vena cava. Lying adjacent to it is the aorta, the largest and thickest artery in the body. The ascending portion of the aorta exits the left ventricle carrying oxygenated blood which will be delivered to all body organs via the systemic circuit. Another large artery, the pulmonary trunk, transports deoxygenated blood away from the right ventricle toward the lungs via the pulmonary circuit. When the heart is retracted, the other large vein, the inferior vena cava, can be seen entering the right atrium. It returns deoxygenated blood to the heart from regions of the body below the diaphragm. Using the specimen which has been removed from the cadaver, we will review some of the other external features of the heart and examine the location of its coronary vessels which distribute blood to the myocardium of the heart wall. The external walls of 3 of the 4 chambers can be identified in this anterior view. One of those chambers is the right atrium with its pouch-like attachment called the auricle. The walls of the right ventricle and the left ventricle and the auricle of the left atrium are also seen in this view. The wall of the left atrium is more clearly seen when the heart is turned posteriorly. Lying inferior to the left atrium are the left ventricle and the right ventricle. Sulci are depressions on the surface of the heart which overlie the fibrous skeleton that partitions the heart into atria and ventricles. The coronary sulcus, sometimes called the atrioventricular groove, encircles the heart like a crown and is the surface landmark for the separation of the atria and ventricles. Anteriorly, the right coronary sulcus lies between the right atrium and the right ventricle. The anterior interventricular sulcus overlies the interventricular septum between the right ventricle and the left ventricle. The location of this interventricular septum between the 2 ventricles is shown on the heart's posterior surface by the position of the posterior interventricular sulcus. The right and left coronary arteries, which are branches of the ascending portion of the aorta, furnish oxygenated blood to the heart wall and are located within the depressions on the surface of the heart. They're surrounded by fat and connective tissue which have been removed in this specimen. The origin of the right coronary artery from the aorta can be seen when the auricle of the right atrium is reflected. It gives off branches to both the right atrium and right ventricle as it descends in the coronary sulcus. One of its major branches, the marginal artery, travels toward the apex and supplies the right ventricle. The right coronary artery continues onto the posterior aspect of the heart in the coronary sulcus and terminates as the posterior interventricular artery. This vessel lies in the posterior interventricular sulcus and furnishes blood to both the right and left ventricles. The left coronary artery distributes oxygenated blood to the left side of the heart. This vessel is short and divides very soon after it branches from the aorta. One of its branches, the anterior interventricular artery, courses in the anterior interventricular sulcus and gives off arterial branches, which supply both the right and left ventricles. The other branch, the circumflex artery, follows the coronary sulcus around to the posterior surface of the heart and supplies the left atrium and left ventricle. The venous drainage of the heart wall is eventually collected in a large vessel called the coronary sinus. It is located on the posterior surface of the heart in the coronary sulcus, between the left atrium and left ventricle. Blood collected in this vessel empties into the right atrium through the opening of the coronary sinus. The major tributaries of the coronary sinus travel with the arteries that we have described and drain the regions of the heart which are supplied by the arteries they accompany. The great cardiac vein lies near the anterior interventricular artery in the anterior interventricular sulcus. It receives blood from both ventricles as it travels from the apex of the heart toward the coronary sinus. Another vessel, the small cardiac vein, drains the right margin of the heart and travels posteriorly with the right coronary artery in the coronary sulcus. On the posterior surface, accompanying the posterior interventricular artery in the sulcus, is the middle cardiac vein. It receives venous blood from both ventricles as it ascends toward the coronary sinus. This specimen has been dissected so that we can view the four chambers of the heart and compare the muscular walls surrounding them. The chambers are the right atrium, the left atrium, the right ventricle, and the left ventricle. There is a difference in the thickness of the cardiac muscle layer which forms the walls of these chambers. In general, the atrial walls are thinner than those of the ventricles, and the myocardium of the left ventricle is thicker than that of the right ventricle. The difference in the thickness of the myocardium in the left and right ventricular walls is related to the difference in the amount of work that each chamber does. The left ventricular muscular wall is the strongest pump in the heart because it must send blood via the systemic circuit to areas of the body which are sometimes great distances from the heart. The right ventricle, on the other hand, sends blood only to the lungs, which are located very close to the heart. The thick interventricular septum partitions the right and left ventricles. This heart specimen has been dissected to allow viewing of the internal anatomy of its chambers. The first chamber we'll examine is the right atrium. The posterior wall is smooth, but the anterior part of the chamber contains muscular ridges called pectinate muscles. Lying near the interatrial septum in the medial wall of the right atrium is the fossa ovalis. This depression represents the site of the foramen ovale in the fetal heart. The foramen ovale allows blood to be shunted directly from the right atrium of the fetal heart to the left atrium, and consequently to bypass circulation through the lungs. This opening normally closes shortly after birth and remains as a slight depression in the wall of the adult heart. The superior vena cava, which opens into the right atrium, delivers deoxygenated blood from the upper part of the body. The entrance of the inferior vena cava allows blood from the lower body to return to the heart. The smaller opening of the coronary sinus lies near that of the inferior vena cava and directs blood collected from the myocardium of the heart wall into the right atrium. We will now examine the internal anatomy of the left atrium. It has a smooth wall and contains 4 openings into the chamber. These openings can be seen more clearly when the left atrium is viewed posteriorly. They are the openings through which the 4 pulmonary veins return oxygenated blood to the heart from the lungs. Located between the atria and the ventricles are valves, which prevent backward flow of blood into the atria during the cardiac cycle. The right atrioventricular, or tricuspid valve, is found between the right atrium and right ventricle. The left atrioventricular, or bicuspid valve, which is sometimes called the mitral valve, separates the left atrium and the left ventricle. Attached to the undersurface of these valves